Mental disorders have been plaguing the world for thousands of years. The history of schizophrenia, however, can be tracked back to the early emergence of psychiatry. The term schizophrenia is a mental disorder characterized by disorganized thought processes, disrupted perceptions, and diminished or exaggerated emotional responses, and that's how the National Intermediate Mental Health defines it. Although evidence supports the claim that schizophrenia has always affected the human population, specific cases of the illness dates back to 1809. A schizophrenic might even sit still for hours without speaking or moving. Most people who suffer from schizophrenia struggle with maintaining a job or caring for themselves, causing them to rely on other people. There are treatments that help to equal out some of the symptoms associated with schizophrenia, but most individuals will have to learn to live their disorder for the rest of their lives. Researchers are still looking for more effective methods of treatment and medications to better understand and treat schizophrenia, along with its various symptoms. The symptoms of schizophrenia can be classified into three different groups: positive symptoms, negative symptoms, and cognitive symptoms. Cognitive symptoms are associated with impairment to cognitive functions pertaining to mental processes of perception, memory, judgment, and reasoning. Similar to that of negative symptoms, cognitive symptoms might be hard to recognize as part of schizophrenia. There are several distinguished types of positive symptoms: hallucinations, delusions, thought disorders, and movement disorders. Hallucinations are defined as anything a person sees, smells, hears, or feels that nobody else can. The most common hallucination are auditory ones. It is not uncommon for people with schizophrenia to hear voices. These voices may not talk about the person with the disorder, or these voices may talk about the person with the disorder, command him or her to do things, or warn of a grave danger. Usually these voices will be heard far before anybody else notices the problem. Aside from hearing voices, other hallucinations include seeing non-existent people or objects. They may even feel like someone is touching them while no one is around. Delusions are strong, bizarre beliefs that are not usually a part of a person's culture. The individual will still believe the delusion even after it has been disproved. Delusions are often very strange and illogical. For example, someone might feel like their neighbors are controlling their minds, or that certain advertisements are directly solely towards them. Paranoid delusions are the most prevalent, where someone believes that the others are plotting to harm, poison, spy, or harass them. Thought disorders are abnormal ways of thinking. This is when someone has trouble organizing their thoughts into a coherent and logical manner. Signs of this symptom may be disorganized speech that is difficult to understand. A person with a thought disorder might make up meaningless words or neologisms. Movement disorders are another positive symptom that involve disorderly movements or body motions. In severe cases, catatonic behavior can occur. Negative symptoms of schizophrenia are less obvious than that of the positive symptoms. Negative symptoms reflect disruptions of an individual's normal emotional expressions. They are harder to recognize, as a part of schizophrenia can be confused with depression or other conditions. Affective flattening is a loss of emotional expression. The flat effect can be recognized by monotonous voices and little to no facial expressions. Another type of negative symptom is reduction in speech. Even when being forced to interact, this is known as ology. Avolition, the lack of motivation or interest in daily activities, is often seen as schizophrenics. People who display negative symptoms of this disorder require help to function on a regular day-to-day basis. Negative symptoms are often associated with laziness, which can lead to negligence of base personal hygiene. Similar to that of negative symptoms is cognitive symptoms. Examples of cognitive symptoms include inability to focus, short attention span, and poor working memory. Some people might even have to have a reduced ability to process information and use it to make logical decisions. Individuals with cognitive impairments find it difficult to live a normal life, which can result in severe emotional anxiety. And it is estimated that there are about 26 million people worldwide who suffer from schizophrenia. This disorder affects both men and women equally. Although men generally display symptoms earlier than women do, there are no detectable patterns between ethnic groups in disorder either. Diagnosing schizophrenia in teenagers can be difficult because many of early behavioral signs of disorder is common among teenagers. Schizophrenia is normally diagnosed throughout adolescent years into early stages of adulthood. There are few treatments for schizophrenia. Medical and psychiatrical therapy. Because the causes of this mental illness is not definite, treatment focuses on reducing the symptoms and helping the individual cope with this disorder. Antipsychotic medications help the individual cope with this disorder and symptoms and help significantly reduce the positive symptoms of schizophrenia. These drugs work by blocking the effects of chemicals in the brain to prevent hallucinations and delusions. Current available drugs have very limited effects on negative and cognitive symptoms, so other methods must be used. Psychiatrical treatments assist patients in dealing with the symptoms that are determinable to delay life. These treatments are forms of therapy that indicate individuals with schizophrenia on how to recognize when the disorder is affecting them and how to try and make it stop. The causes of schizophrenia are not entirely certain. Experts believe that several factors play a role in how and who this mental illness will affect. Scientists theorize on an anatomical level that schizophrenia results from the neurotransmitter pathways in the central nervous system. Essentially, chemical messengers along the brain and spinal cord do not effectively transmit electrical impulse necessary for efficient communication. Studies also suggest that abnormals in neurological development during infancy play a part as well. It is known that this disorder is genetic, but an individual's environment serves a virtual key into triggering the symptoms.